Hi, this is Dr. Riley. Today we're going to talk about the medical treatment of autism. And so I have here some news articles about kids who've been treated for autism. And, in these articles, it talks about how they're able to talk. And certainly some of this stuff sounds unbelievable, but I'm here to tell you that we could actually publish articles from RBK because we've been having similar results. So how do we do this? So first, just a little background about autism. And when I was a young doctor, or actually in medical school, it was 1 of 1,000 kids would have autism, and now it's 1 out of every 36. And when I was looking in our records at RBK, it came out to be about 1 out of every 40. And when I was in medical school, they told us it was all genetics, but obviously it's not genetics when it's something like this. It seems like there's a confluence of factors, and a lot of it has to do with the environment and the effect on mitochondria. And I have another video that talks about autism and how to prevent it. So I would have you go on watch that video if you wanted more information about this kind of stuff. But this is the problem: when you damage the mitochondria, it can be passed down to multiple generations. And when you're a pediatrician, you're faced with the kids and you want to make them better. So how do we help them? And the first thing we have to do, it seems, we have to do some testing, right? Because testing, it seems to be very important. And this next slide, a little bit scary because there's a lot of tests here, and certainly all of them are important in terms of seeing if there's any problems with the mitochondria. And we're going to be looking at two main ones today. The two that I think are probably the most unfamiliar with people. And we're going to talk a little bit about the omega because that's important too. That stuff is good for everything. We're going to talk about, though, first, the folate receptor alpha antibody. We're going to call it the FRAT antibody. And we're going to talk about carnitine. And carnitine, probably you have some flashbacks important for the function of the mitochondria and using energy. And so the FRAT antibody, this is super important. 70% of kids have this antibody, and 70% is a lot of percent, right? And this is an antibody against the folate receptor alpha, which is the main mechanism by which folate goes into our brains. And if 70% of the autistic kids have this, that means 70% of them have an autoantibody. So they have an autoimmune disease. And unfortunately, this antibody will be fairly successful at blocking the ability of folate to actually go into the brain. And you can see how this is like a problem, because you could actually check the blood, see the folate is fine, and be clueless about how much is actually inside the brain. And they were able to figure this out. And when the guys discovered that 70% of the kids have this, they're like, wow, this is terrible. But luckily, we have this RFC, reduced folate carrier. This is actually something where we're having almost like a backup system, where if we have reduced forms of folates, like folinic acid, the brand name is leucovorin. And this is the unfortunate thing, is that most doctors are more familiar with leucovorin when you're giving chemotherapy. You give leucovorin as kind of like the antidote. But it's a vitamin. It's a vitamin. It's something that's naturally inside our body. So it's not anything bad, right? And so what they did is that they, because we have tons of experience with leucovorin, that's super safe, right? So they gave these guys um, folinic acid, also known as leucovorin, because they saw that, yeah, we can actually give it to them and it'll go through this reduced folate carrier. We can actually replenish the folate that these kids are missing, that they've been missing all the time. That 70% of the kids have been missing all the time, but we weren't smart enough to know. So they did a study, but they didn't just do a study of giving kids folinic acid when they had the FRAT antibody. They realized that if the kids were unhealthy and they went after some of the normal things that we would check, right? So like on that previous slide, we showed, we check iron and zinc and all these kind of vitamins and minerals. And if they saw they were low, they gave them vitamins. But if they had the FRAT antibody, they also gave them folinic acid. And I'm going to try to walk you through this graph because this is super important. And this is the day after I read this, I kind of realized that I have to do this for my own patients because this is super important, right? So in this light blue graph or this light blue bar, you could see that this is what this is meant to show is kids' typical care. They get ABA, they get everything I've been doing my whole life, right? But nothing else. The orange are the kids who they measured the bloods. If they were positive for the FRAT antibody, they gave them folinic acid. And you can see that the kids, typical care, nothing happened to them. They stayed the same level of autism as they were before, because these were all kids. They chose kids who had severe autism. But the kids who got treatment, they dropped from severe autism to mild to moderate autism. This is crazy, right? Because before I read this, I was getting the idea that something might happen, but that it would be so substantial. Once you realize this, you have to, you feel like you need to do this for your kids, right? So just yesterday, I had a kid who, after I read this, I started to make some of this kind of stuff happen, and now the kid was nonverbal, 3 years old, and now she talks. It's crazy how good a lot of this kind of stuff works. But I think that we get better results than the guys actually even got in this study, because in this study they're always looking for like one thing. We're doing actually more things, right? So yeah, so more information about the FRAT antibody. The FRAT antibody is against the folate receptor alpha, as we said, and this folate receptor alpha is found in milk. So that begs the question: what happens if you take away the milk? So they did this, and what they saw was that the level of the antibodies went down, and then when they reintroduced the milk, the level of the antibodies went up again. So it seems to almost fulfill Koch's postulate, where you take it away and then the antibodies go down. And since these antibodies are not good for us, that it's actually blocking the ability for folate to go into our brain, then we should stay away from milk. And that's one of the things that I do. I tell all of them, look, you have this antibody, you have an autoimmune disease, you have to stay away from milk, and then that's it, right? No milk, right? And then the second thing I do is I kind of say further, I say, look, yes, you have autoantibodies, so that means you have autoimmune disease. So I do for them the same I do for my other patients who have autoimmune disease. I also tell them usually to stay away from milk, because milk seems to be one of these things that triggers a lot of this kind of stuff. But I also tell them to stay away from grains, right? So, and it's very well known that autistic kids have more problems with celiac disease. That's why in the blood test, we actually measure tests for celiac disease and things like that. But once you have this, I would think, like, what would I do if my own kid had this? I would take away all the grains, right? And part of the reason why I take away all the grains is because studies like this that came out this year, where the parents thought they were doing a good job giving the kids oats every day, and it seemed like it caused them to have more antibodies against type 1 diabetes. In the same study, which there are tons of studies like this is not new, that the more sugary fruits that the kids were eating, the more likely they were to have more problems. Now, interesting protective was berries. So it seems like berries were actually fine, but bananas were not fine. So, I would encourage people who are interested in this kind of stuff to kind of look at some of these kind of studies. They're very eye-opening, but I just make it easy for them. I say no grains and fruits, maybe just like once a day, and try to stay away from the most highest glycemic index fruits. Carnitine was also been studied, and carnitine you saw was on my list, and it's because carnitine, they've done studies where they gave people carnitine who had autism and their CAR score went down, right? So similar to the folinic acid, similar to treating them when they have nutritional deficiencies, that if you kind of take care of these kinds of things, the CAR score goes down, the autism gets better. Carnitine is found in meat. That's carne means meat in Spanish. So, I encourage kids to eat more meat. I try to make sure that they're kind of having meat with every meal, and that meat for breakfast, meat for lunch, meat for dinner, meat for snack, right? They're trying to eat a lot more meat, right? And then usually it's the kind of thing we measure their carnitine level. If it's low, we don't wait to see eating more meat and see what happens. We usually are going to give them carnitine, right? And usually this will actually help them, right? So it seemed like the the magnitude of the effect was less than it was the folinic acid. So I'm not a big fan of doing tons of stuff all at once for these kind of guys. So usually first folinic acid, then carnitine, then all the other things, right? Next is the spectrum need. So if there's some abnormalities in the blood tests that seem like there's problems with the mitochondria, which there almost always are, because it seems like it's a problem with the mitochondrial function, then we'll give them a vitamin like this, which is like tons of vitamins, basically, that all of them are supposed to be helpful for the normal function of the mitochondria. So this also is based on data. There's data that shows that kids who take these vitamins, you know, that they seem like they help them, right? Omega is good for everything, and autism is no different. And so usually what we do is we actually measure the levels of the omega-3 fatty acids. And if they're low, we give them omega. These are two brands that seem like they're known for their quality. And we give them a gram a day. And it seems like this is actually also very successful, right? I remember one patient, as soon as I gave them the omega, the kid was able to increase their verbal ability. And if you look at some of the studies that I've given you here or do other PubMed searches, you'll see that this is a thing, right? So to summarize that, if you want atypical results for your autistic patients, then you're going to have to do things that are not the typical things, right? Because like I showed you in the other graph, if we do the same thing that we've always been doing, what we're going to find is we're going to have a lot of kids that they're going to be in big trouble. But if you want to have results like we are getting, right, then all you have to do are these simple, safe things, and your kids will do much better, right? And you know, it's just wonderful. It's wonderful to be able to do these kinds of things, right? And if you want any help, I'm very happy to help people. I have all the energy in the world to be able to help people to be able to do this kind of stuff, because quite frankly, I'm starting to not have any spots to be able to help these kids, because once you start helping one kid and everyone around them sees the good results, they want to have the same results as these kids who were originally nonverbal, and then just a few months after you start treating them, they start being able to talk. All right, so that's everything I wanted to say for today. This talk could have been hours long, but I'm trying to make it short so that way everybody can actually see the benefits and then hopefully incorporate some of this stuff into their own practice. Thanks.